For the past 2 years, we've lived through a viral pandemic that has caused schools to close, businesses to shut down, and a disruption in our normal lifestyle. There has been many pandemics before. COVID isn't the first pandemic, and it won't be the last. Poliomyelitis was a virus that spread all over the world and infected a lot of people. Polio weakened your muscles so you weren't able to move your body and sometimes even breathe. It affected children mostly under the age of 5.
They invented the iron lung to help patients with polio breathe. Many that got polio got damage to their nerves, which caused them to be permanently weak or even paralyzed. When looking at mummies, there were signs of polio, which could mean that polio started about 6,000 years ago. In this project, we will focus on the 1949 poliomyelitis epidemic, just after World War II, that hurt children, killed adults, but ended with the creation of a vaccine.
Poliomyelitis is caused by a virus that damages a person's neurological system, causing paralysis and breathing difficulty. The iron lung was invented to help the people infected with polio breathe. In the 1930s, the polio vaccine was discovered, administered, and widely accepted by the American people, proving that a lot has changed in America's trust in the government and science in the past century.
Poliomyelitis is caused by a virus that damages a person's neurological system, causing paralysis and breathing difficulty. The iron lung was invented to help people infected with polio to breathe. Even more importantly, the polio vaccine was discovered, which led to the eradication of polio. This means that polio was permanently stopped from spreading. Our debate and diplomacy of poliomyelitis is, back then people trusted the government more than they do now and agreed with their decisions and choices because they thought it was safer and had no other options on what to believe. Now people don't have as much trust in the government and make their own health decisions. We think that people had more trust in the government before because they didn't have as many trustworthy sources that they could get their information from, because health decisions, so that they trusted the government.
But now medicine has advanced and people have many other beliefs or opinions that they can choose from than getting it from doctors. The polio vaccine took so long to come out that people couldn't get it fast enough. But people were still hesitant to get the polio vaccine. They had to be convinced that this was safe and going to help cure polio because they had many other bad vaccines. For our evidence, we use sources such as the CDC websites, articles that help us with medicine and prevention of the disease, and websites that show the facts about polio that are important. And we looked at everyone literally Wait, let me hear it. You're not going to move it. Can I have an order?
So much that there are many different ways to handle infectious diseases. In the 1940s and 50s, there weren't as many places to get misinformation from about vaccines, and more Americans had a deep respect for science. The polio epidemic was so terrifying that the people were eager to get the vaccine. It was so much different disease. It was a much different disease and more severe consequences than coronavirus.
For our evidence, we use sources such as the CDC websites, articles that help with medicine and prevention of the disease, and websites that show the facts about polio that are important. And we looked at some photos to help us get an idea of what polio is, what people looked like when they had it, and what they used to cure and help people with it. We used this photo to help us learn how doctors helped people with polio when they were weak and couldn't move, what the iron lung looked like and how it worked. If the iron lung or vaccine had ever been created, more people who were infected would have not survived and the virus would have continued to spread.
Poliomyelitis is a viral infection and there's no cure. The treatment was either to help people breathe or to rehabilitate. In some cases, the lungs of polio patients would be affected negatively by the virus. This is why they created the iron lung to help patients breathe. The iron lung looks like a giant metal tube that the whole body can fit into. It had a vacuum to pull the chest to make air go in and out of the lungs. COVID is a virus, but there are many other treatment options. One of the options is a pill called Paxlovid. COVID can affect the lungs, but they no longer use the iron lung.
In Chicago, for the coronavirus, we had 6,597 deaths. The majority of these people that died are 70 and above. Kids rarely had severe illnesses from COVID.
The polio vaccine was available in 1955. The polio vaccine took a very, very long time to get approved. They started testing it in 1933. Because the polio was so dangerous, people were so eager to get the vaccine as quickly as they could. The first cases of COVID were in January to February of 2022 in America. The vaccine became available in December of 2022. Within 10 months, a vaccine was invented and available.
Before a vaccine was available, polio caused more than 15,000 cases of parallelism a year. In 1952, the U.S. had the highest number of cases, 57,879, resulting in 3,195 deaths. Kids seem to be targeted by polio, causing this to be very scary for families. Polio affected different races because they were treated differently and treated like they were being tested or not cared for. They were also given the vaccine, but it was the wrong vaccine, so it didn't help them. So they would most likely all get sick and die from polio. These people would be refused care because of their race and were left to suffer and die because they weren't treated with as much care as any other people. This has also affected the same race during COVID because people were scared that what happened to African Americans in polio would happen to them during COVID. So most African Americans did not get the vaccine in the beginning, and still most have not. There was also a movement created called Tuskegee that helped bring awareness to what happened to African Americans during this disease. We cannot blame these people for not giving the COVID vaccine and not having trust in the government because they were treated like guinea pigs and were not even aware the government was doing things to them.
In conclusion, our thesis, poliomyelitis, is caused by a virus that damages a person's neurologic system, causing paralysis and breathing difficulty. The iron lung was invented to help people infected with polio breathe. In the 1950s, the polio vaccine was discovered, administered, and widely accepted around the American people, proving that a lot has changed in the Americans. Trust in the government and the science in the past century. Our thesis is proven that's somewhat correct. Even though all the information stated is correct, the vaccine was not widely accepted during this time. There was an act created called the Tuskegee Act that helped bring awareness to what was happening to African American people. African Americans would be used as test guinea pigs and given the wrong vaccine, which didn't help them, and would be reduced care and left to die and suffer.